Hello everyone. Today we are going to discuss about the NES UK, that is basically a private organization that hires the doctors of different specialties and different levels. Basically today we are going to discuss about resident medical officer jobs which are offered by the NES UK NES, and that organization basically work under the guidelines of NHS, and but it is a separate organization. So they usually open the vacancies two times a year, usually in the January and in the June and July. And now at this time, their vacancies are also open, and they are hiring the doctors, resident medical officers till June 2024. So it is basically a very easy way to get job in the UK after, if you are trying to get a job on a junior level, because this title is equivalent to FY2 or senior house officer jobs in the UK. And if we talk about the procedure, how you can get job in the NES, first of all, we have to apply over the NES website, open the NES website, and fill the registration form of that website, and then you will be contacted by email. And you also have to send them a small CV, 3 to 4 pages CV is enough, and to summarize your experience, whatever you have done till now. Basically, they need a you need GMC registration and more than 2 years of postgraduate clinical experience. Preferably, they have more vacancies in the surgery department. So it is good that if you have current job in surgery department or previous job within the last 2 years in the surgery department for more than 6 months, they usually prefer the doctor in the surgery. But they also have some vacancies in medicine and pediatrics hospitals, so they can also take the doctors if they are working in their specialties, but they are less chances. So if you are lucky to get job in the NES, that is basically a very easy way. As I told you, first of all, you go to the website and fill the registration form and upload the CV. Then they will contact you via email, and then next procedure starts. They will send you some document. You have to fill that document and send them back. And first of all, they basically send you a pre-CV template. First of all, you send them CV of 3 to 4 pages, then they send you your their own CV to you. You fill that pre-CV template, and after that pre-CV template, they send you a complete CV template that you have to fill also. So just be careful while filling those sections of the CV, because they have described what they want to hear from you. Basically, they want to hear from the procedures what you have done independently, and the procedure which you had done dependently, and also many other things they have described in the job description. So read that carefully before filling up that job history and employment history, because sometimes they reject the CV based on if you just copy paste the thing from your previous CVs. So be careful. That is not very complicated, just a simple thing. And you also just should have some average of procedure which you have done till now. They have a segment in their CV which they ask about the number of procedure which you have done over the all the roles which you have done till now, like in the surgery, like in the medicine, pediatrics, FY1, FY2, and at the end they also ask the total procedure. So that is just the estimate. So be careful in filling their CV, otherwise that your CV will be rejected. Maybe you will be contacted again. So after these two CVs, they will send you a English suitability test link. That is basically a very simple test, and that is done over a link. They will send you a link, and you have to open the link, and you can do that test at any time. And the advantage of that test is that it's just you have to select the correct options, and there are almost 30 questions and almost 20 to 30 minutes. I'm not confirmed at this time. And you have to fill that, and you can do while you are googling the answer, you can do while you are having some friends with you, or on the call, because just MCQ based test, and very simple English test. So after passing that test, that is only a 30 question test, a very simple test, and you then invited for the first interview. There are basically two interviews that the taken by the NES. First interview is audio, second is video. First interview is taken by the person who is talking to do via email, and in that interview they will give you a time and date, at which time they will ask you if you're comfortable to give the interview. and that interview will be taken over the cellular data, and that can also be taken over the WhatsApp. Because while I was giving the interview, there some problem happened, so I gave my interview over the WhatsApp. So in the first interview, that is taken over the audio, they will talk about your CV, your procedures or skill. That is just a talk to a HR person, that is not a medical person, but they just simple know about the medical terms. So that is very a simple talk in the interview. About, you don't have to prepare your interview, you just need to view your CV, what you have done in your CV, and what you need to describe to the person who is talking to you over the first interview. And they will also ask you about what are the procedure you can do independently, and what the procedure you do dependently, and how many beds you see daily in your routine, what your routine. So these basic things are asked in your first interview, that is taken over the audio, right? And if you are successful in that interview, you will be contacted for the second interview, that is 1 to 2 weeks after that first interview. And the second interview is taken over the video, and that is basically taken by the consultant. But they're also very simple interview, basic things they ask. They also ask about the preferences, because there are many hospitals of the NES in working privately in the UK. They will ask about the preferences, and there are two types of jobs which they offer of a resident medical officer. There are two patterns of job basically. One pattern is like, you have to stay 1 week in the hospital, and meanwhile staying in the hospital they will provide you food and accommodation, and the next week completely off. This is the one pattern, that is high paid job pattern. Second pattern is like, you daily go to the hospital only for the day duty or only for the night duty, and for the 8 to 10 hours duty, then you go come back to your own accommodation on home. And that is basically less paid pattern, and you daily come to the home on routine basis. So they will also ask about which pattern you would like to join. So basically they will ask about the preference of the hospital, and also the pattern of the job which you want to take after the job. So after this video interview, if you're successful, you will get email of congratulation and job offer. And after accepting that job offer, you will be asked some few pre-employment checks, including some vaccination status and some other things. And after that you will be issued the certificate of sponsorship. So these were all the procedure while you are applying for the NEST jobs and NEST applications. And I hope I have cleared everything, and there are a lot of benefits if you lucky to get the next job. That is very easy first of all. And also you will get a chance to get your trust form signed, because it is necessary to work in the NHS, and you can get your trust form signed while you are working in the NES. You can also get some courses done, ACLS, BLS and PALS. They will cut this the fund from your monthly pay, because these tests cost almost 100,000 to 1,500 pounds, and they will cut it from your monthly pay from 20%, 50%, whatever you want to get cut from your pay. You will get experience of the UK, and you will accept how the system work in the UK, the speaking to the person, speaking to the patients. So this kind of things will definitely benefit you while you are working in the nest. There is my friends say that the things, the job is somewhat hectic as compared to NHS, but ultimately you will get a lot of benefits, and they can help you to get into training job in the NHS and also non-training job in the NHS. Thank you.